Let us say good morning to everyone. I'm Reverend Curtis Gatewood. I'm the Director for Field Operations for the North Carolina State Conference of the NAACP, and we are very excited about while we are here today. And on the phone, I have the North Carolina NAACP State Conference President, Reverend Dr. William J. Barber II, our leader also of the Forward Together Moral Movement. And I would like for him to start us off this morning. Reverend Barber.
Thank you so much, Reverend Gatewood, and to all who are there, especially all of our branch leadership from out west. And what I want to say to the media today is, as you can see, standing at the podium, the NAACP is not a black organization, a white organization, or a brown organization. We're a justice organization. We're a civil rights organization. And we've been that way since 1909. We were diverse in our beginning. We're diverse in our current state, and we'll be diverse in our future. But also to those media, particularly those that are listening in from other parts of the state, the western branches are having a major Moral Monday in the western part of the state. They'll tell you all about it. But they wanted to come down to the legislature and to render their critique of how the policies being passed by this current extreme legislature and governor are hurting all people. For instance, yesterday you saw the governor say that he was asking for a Medicaid waiver and attempted to use, again, another campaign stunt to divert the real issues. Doesn't have to do a waiver. He could sign Medicaid expansion right now. We've been 3 years too late. This process may take another 36 months. While he's doing that, people are dying, hospitals are hurting, the sick are crying out. And I want you to listen today, people from Western North Carolina who will talk about the hurt. And many of the persons there happen to be white. But as Dr. King said, when you deny health care, you hurt. It is one of the most grievous things you can do. And it's hurting all people. The governor said on yesterday, for instance, he wanted to make sure that Medicaid expansion goes to those who need it. Well, in its current form, it would go to those who need it. Working poor people, veterans, people who have to make the choice between food and health care, 500,000 North Carolinians, 386,000 of them are white, some 100,000 are African American. All of them, though, deserve health care. And that's just one issue that they'll talk about today. I'm sure somebody's going to talk about how this bill, the so-called lower tuition, not only hurts HBCUs, but will hurt Western Carolina, where out in Sylva, where we will have the Moral Monday, and will hurt Pembroke School, and how it is just a ploy. And when Senator Apodaca says he wouldn't do anything to hurt his alma mater or to hurt people in Western North Carolina, that's where he's from. Well, listen to the people today, and they will in fact tell you that he has passed bill after bill that in fact is hurting people in Western North Carolina, that in fact is hurting the very people that he claims to want to represent. So I'm excited that you all are there. Wish I could be there. That we will be back, but we certainly, Lord's willing, will be with you on the 13th in Western North Carolina. And as we say all the time, forward together.
Not one step back.
God bless you all.
God bless you. Yes, and before turning over, I do want to just let you know that we have our best-selling author, Professor Dr. Timothy Tyson, who we are lucky enough to have as our Education Committee Chair for the North Carolina NAACP, who's also going to be bringing you greetings and a welcome. Dr. Tyson.
Good morning. I'm Tim Tyson. As Reverend Gatewood mentioned, I'm the state NAACP's education chair. In 2013, I got a phone call from my niece, who's from Mitchell County, and she said, "You sure are stirring things up in Mitchell County." I knew from Allison that Mitchell County was 99% white or so, and about roughly 90% Republican. So I wondered what that was going on. And what she said was that the folks were meeting at the Food Line parking lot on twice a week. They were meeting on Sunday afternoon for a rally, and then meeting in the wee hours of the morning on Monday, and coming down to Moral Monday demonstrations in Raleigh. I asked Reverend Barber if we could go to Mitchell County And when we got, he agreed. Actually, what he said is, "Damn, I knew you were going to get me killed." But when we got there, what we found was a large and enthusiastic crowd, deeply concerned about public education and issues around poverty, like Medicaid expansion. Soon thereafter, 10,000 people, according to the police estimate, showed up for Mountain Moral Monday in Asheville. Since then, we've witnessed the birth of 5 new NAACP branches, majority white NAACP branches in the western counties. With the remarkable energy and dedication, those join several existing branches. I think we've got Yancey, Mitchell, Swain, Jackson, and Buncombe County represented here this morning. But as Education Chair, I just wanted to welcome our brothers and sisters from the western part of the state to talk about Mountain Moral Monday. Thank you.
Good morning. My name is Enrique Gomez. I am president of the Jackson County branch of the NAACP. On Monday, June 13th, coming up at 5 p.m., there is going to be a Moral Monday event in Sylva, North Carolina. It is going to be at Bridge Park. Members of the legislature were coming here. We're going to invite them to come and hear the stories of people that have long been neglected by choices of this particular legislature that have affected all aspects of their livelihood. Yes, Reverend Barber is going to be there, and he is going to bring his representation of the movement and his prophetic voice. But we are also going to highlight other stories that have not been heard before, that our legislators need to hear, that members of the media need to hear, so that we can see the full effect of this extreme legislature in the lives of North Carolinians, particularly out west. At this point, what I want to do is that I want to present the leadership of the NAACP branches of Yancey, Mitchell counties.
Thank you, Enrique. Good morning. My name is Robin Ellis, and I'm from the Yancey, Mitchell, NAACP. We're proud to be one of the 5 newer branches and to be part of the North Carolina Conference of Branches. We know that we share the same concerns about issues up in Burnsville and Spruce Pine and Bakersville with people throughout the state. And we are a predominantly 99% Caucasian county. Bakersville is considered the most conservative city in the state. We have the least amount of Democrats registered to vote in the state and the second least amount of African Americans registered to vote in the state. But out of the 25,000 people that make up both counties of Yancey and Mitchell, 1,500 people are without insurance and fall into the Medicaid expansion gap. We have the same hopes and dreams that other people have in the state. A decent education for our children, the opportunity to make a living wage, voting rights, equal rights, clean environment, and most definitely affordable health care. The idea of having access to health care is very dear to us in Yancey and Mitchell counties because one of the leading and the loudest opponents of accepting federal funds to provide health care benefits for all citizens is from my hometown, legislator Ralph Heiss from Spruce Pine. He has continued to shout a resounding no to expansion, regardless of presenting letters written, pleas from constituents, or the deaths of his friends and family members. And there have and there will be more deaths. Last year I came to speak to our representatives Michelle Presnell and Josh Dobson in Raleigh about issues and concern we had in general in our area. I should have been accompanied by our branch president, vice president, Raven Tata, but she had just died from an easily treatable cancer that she would have been able to diagnose during procedures that would have been covered by Medicaid expansion, but she did not have that. She was a working woman with a family and children and she fell into the Medicaid gap, and she's no longer here. Her needless and senseless death was a direct result of your bad policy, Ralph Heiss, Michelle Presnell, Josh Dobson, and your inability or unwillingness to admit your mistakes. Since then, our branch has been researching and studying the economic and human effects that by not accepting Medicaid expansion, what it's done to our area. That same area of your friends and family, Representative Presnell, the same area of your constituents, Josh Dobson, and the same area of your neighbors, Senator Heiss. We've spoke with active and retired doctors, the local hospital, medical clinics, healthcare workers, city council members, and county commissioners, and we did not find a single person, not one person, who felt that denying health care for 500,000 North Carolinians was a good idea. Not one person. So who are you representing, Michelle Presnell? And who are you representing, Josh Dobson? Who are you speaking for, Ralph Heiss? You know the facts, so where is this disconnect happening? Do you think that in November that your constituents will thank you for federal funding lost, for employment lost, for production lost, for state tax revenue lost, for county tax revenue lost, and for their family members' lives lost? I think that everything has been said about the negative effects of not accepting Medicaid expansion. We've attended hearings, we've written letters, but now I'd like you to hear from Bob Carey about our Medicaid expansion group we have formed in Mitchell and Yancey counties, and later we will share this information with our legislators. Thank you.
Thank you. I'm Bob Carey from Yancey County, and I am a very proud member of the Yancey-Mitchell NAACP, and I'm presenting today on behalf of them. But I would like to bring out some of the other experience in the health area that I've had. I've been a member of Lions International for 54 years. They're known as the Knights of the Blind. I'm presently a member of the PAMI Advisory Committee to Disability Rights of North Carolina, and I was a member of NAMI Western North Carolina for over 20 years, and I was a member of the local Consumer and Family Advisory Committee for several years to Blue Ridge, or it was Western Highlands, LME. So I'm well aware of what's going on around the state. I'm retired from the U.S. Forest Service, and I think that gave me particular insight when I come down here and see that it seems like a lot of times we're talking to trees. They're not listening to us. They're not listening to the cries of the people. I would like to present organizations that we have that have signed resolutions over the past year or so for Medicaid expansion. The Yancey County Board of Commissioners, the Yancey County Department of Social Services Board, the Toe River Health District Board, the Bakersville Community Health Center, the CLO Friends Meeting, CLO Health Center Board, and the Mitchell-Yancey Medical Society. In addition to that, my wife is a member of the State Consumer and Family Advisory Committee on Mental Health, Developmental Disability, and Substance Abuse at the state level, advising the governor and legislators on those issues. They have signed 2 letters in the last year or so I know of to the governor and to the legislators recommending Medicaid expansion. They're not listening to us. As it was mentioned before, that some are trying to maybe get Medicaid as a part, or Medicaid expansion as a part of Medicaid reform. That's just not good enough. I'd like to read a quote, and then I'll tell you who this quote's from. Over the last 5 years, several public hearings have been held, and universally we have had doctors, dentists, nurses, patients, pharmacists, therapists, families, healthcare providers of every stripe all across the state who have spoken very loudly, very clearly with a unified voice, and they have said this. They have said, let us have the opportunity to reform the health care system. Let us put North Carolina ability and know-how into crafting a system that would be truly innovative, a system that rewards quality health care outcomes. Unfortunately, my friends, those voices have largely been ignored. That was a statement that was made by Representative Nelson Dollar, the co-chair of the Joint Legislative Oversight Committee on Medicaid and North Carolina Health Choice during the hearings for the Medicaid reform bill. They're not listening. At least it seems like Nelson Dollar is listening some. Who are they listening to? The article in the paper. Our own Senator Heiss recently was recognized at the General Assembly as the Bayada Home Healthcare North Carolina Legislator of the Year. Bayada is one of his contributors and a privately held company that stated revenues of $815 million in 2012 and that they expected to reach $1 billion revenue in 2014. He was recognized because he inserted budget language in 2015 to increase the PDN nursing rate paid to the providers. Bayada, of course, is one of these providers. They're not listening to us. These are the people that they're listening to. I thank all of you.
Enrique Gomez again, President of the Jackson County NAACP. Jackson County is part of the old homeland of the Cherokee Nation. There's a Cherokee belief, as recorded in James Mooney, that in the mountains of western North Carolina, far west from here, there's a being called Great Thunder, whose thunder rolls through the mountains and echoes in the valleys of the oldest mountain range in the world, the Appalachians. And as it's often the case, this being has given the people medicine to cure many diseases that are in the form of songs and stories. We are here today in the capital of our state, in the house of the people, with some good medicine from the heart of Southern Appalachia for what troubles the hearts and the moral consciences of the people of North Carolina, medicine that rolls like distant thunder and not less powerful. This medicine is the song and stories of many people. They are the songs of the native peoples that have endured centuries of ethnic cleansing and campaigns to eliminate their language and their right to exist. They are the songs and stories of freed African American slaves that escaped the persecution of racist mobs from surrounding states so that they may build thriving communities in the mountains. They are the songs and stories of those who have witnessed over generations the overexploitation of the land, leaving behind the wreckage of contaminated soil and water, and are witnessing this being done again. They are the songs and stories of those who live in the margins, who don't know where their next meal will come from, who do not have access to health care, or they are a health care bill away from hunger and homelessness, and yet choose to live with hope. These are white, black, Latino, Native voices who are being ignored. We know that the people that we have elected to serve all of the people of this state have not heard the stories of those people that have been denied affordable health care because our officials have chosen not to expand Medicaid. We're talking about 1,659 residents of Jackson County, 1,719 residents of Haywood County, 997 of Transylvania County, 67 and 65 Macon County, 555 in Swain County, 932 in Cherokee, 392 in Clay, and 307 in Graham County. Our legislatures have not heard the stories of people who work full-time in multiple jobs without insurance and who cannot still make ends meet. They have not heard about our local governments who were denied the right by the General Assembly with HB 2 to increase our minimum wage to, say, $10.10 an hour, which would have given these working families in the 10 westmost counties in the state $123 million of additional income each year with no expectation for loss of jobs. Our representatives have not heard about how fragile our resources for safe drinking water are and how many people in our mountain communities absolutely depend on well water, which is often near depletion. They have taken away our mountain communities' ability to protect our groundwater sources from fracking wastewater in our region. They have not understood that our part of the Appalachian Mountains have some of the highest concentrations of radioactive isotopes such as radon-222 and lead-210 with radioactive decay products that pose elevated health risks such as have been seen in the Marcellus Slate in states north of us. They do not know how fracking wastewater spills can inject radioactive radium-226 originating from miles down below the ground to near groundwater that people depend on. We're extremely concerned about a bill being considered today, HB 169, that essentially will allow electronic waste in our landfills. We know that over decades, those heavy metals in these electronic sources will leach out, will be part of the groundwater, will flow into streams and rivers. These are heavy metals that need to be recycled, that the United States does not have enough to support its own electronic industry and need to be imported from places like China. We have come here to sing the song of our peoples in the far west of the state, that it be known that the Forward Together moral movement is present and rooted in the mountains of North Carolina. On Monday, June 13 at 5 p.m., the NAACP with our allies will have a Moral Monday in downtown Sylva on Bridge Park, that we will hear and that it be known the stories of these people that have been ignored and neglected. The general public must come. Our legislators must come. The media must come, because these are stories that are not being heard. Thank you very much. Have a good afternoon.
I would like to, as we get ready to conclude, and we'll probably have some words from our Field Secretary for the Western area, is to just say something to the so-called religious, political football that's being used. A lot of times when we talk about religion and evangelicals, we're only talking about issues of homosexuality or abortion or prayer in schools, after we've been given so much hell that we need to pray. But we never talk about religion when we're talking about how 500,000 people in North Carolina were denied Medicaid expansion when we already had 1.7 million North Carolinians living in poverty, and over 600,000 of which were children. So we wanted to make sure that we understand that we bring the moral and religious family together on issues of Medicaid expansion. When you hear about real lives that were lost of people we know, because we are denying people Medicaid expansion where the dollars were there, the policy was there, and they're just using interposition and nullification to stop what had already been passed at the federal level. And the last thing is, we want to thank also Attorney Larry Hall, Leader Hall, for hosting this event today. We want to say to those legislators who are doing the right thing, thank you. And to those who are not, we are not going anywhere. We're going to stand together, black, white, red, brown. We're going forward together and not one step back. Laura, did you want to close out?
It's very clear that what is happening in the West is not victimless, and the decisions that are being made by the legislators that are supposedly representing this area are making decisions that are hurting the residents of the Appalachian Mountains. The folks behind me from Jackson County, Swain County, Yancey County, and Mitchell County have already gone and visited the offices of Roger West and Joe Sam Queen. And following this news conference, they'll be going to Ralph Heiss, Deanna Ballard, Jim Davis, Michelle Presnell, and Josh Dobson's offices, both to invite them to the Moral Monday on June 13th, as well as to raise these concerns around Medicaid expansion and many other issues that impact the folks in the mountains. Thank you.
We have some letters and some people that signed off on the letters from Yancey and Mitchell County to give to him about Medicaid expansion. All right. And
Yeah, we've got a list of the ones on here. We just have two of the petitions, but as we say on there,
they're all pretty much
they're all
the same,
pretty much
but,
the
okay.